Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. Taking into account the amount of calcium buildup in the coronary arteries helps improve predictions of who will develop coronary heart disease, according to research published in the Journal of the American Medical Association. Here is some information about the coronary artery calcium score. Also referred to as the cardiac calcium score, it refers to the amount of calcium present in plaque buildup on the coronary arteries. The score is obtained via CT scanning. Buildup of calcium in the arteries is a sign that coronary artery disease is present or developing. Researchers from Northwestern University in Chicago measured the amount of calcium in coronary arteries of nearly 7,000 individuals participating in a study evaluating risk factors for disease of the arteries. At the outset of the study, none of the participants had cardiovascular disease, and those with diabetes were excluded from the analysis. The researchers used two models to assess participants' risk for developing coronary heart disease over the subsequent 5 years. The first model took into account the participants' age, sex, tobacco use, systolic blood pressure, use of medication to control blood pressure, total and HDL cholesterol, and race or ethnicity. The second model used all of these risk factors plus coronary artery calcium score. Among the nearly 6,000 participants who were included in the final analysis, over 200 had a coronary artery disease event, such as a heart attack, during the nearly 6 years of follow-up. Adding coronary calcium score to the risk analysis significantly improved the degree to which investigators were able to predict who would have such an event. In fact, adding this score to the analysis meant that an additional 23% of participants who had actually had a coronary event would be identified as high risk, while an additional 13% of those who did not have a coronary event would be classified as low risk. We had a chance to speak with Dr. Philip Greenland, one of the investigators of this study, who offered some further insight.
The study, I think, provides new information that this kind of test, the heart scan, could be useful. I think it also shows that, considering that the test is only useful in a segment of the healthy population, that this really is a test that should be used only in the context of medical practice. It really should be, if it's being considered at all, it should be ordered by a physician when the doctor thinks that this additional information would be useful, number one, and that the cost and the potential risk of doing an X-ray type test would be justified in terms of a change in the patient's treatment.
Today's research highlights the importance of taking coronary artery calcium score into account when determining one's degree of risk for heart disease. For Insider Medicine in Depth, I'm Dr. Susan Sharma.